Hey y'all, Shelly here with another tip for hospice nurses. So whenever as a hospice nurse, you're going to take care of patients who have ostomies, whether it's a colostomy or an ileostomy, you're going to see this. And a lot of times with the patients that we're taking care of, these are not going to be the well-heeled, simple, straightforward ostomies. Usually it's going to be on patients that have had multiple surgeries and ostomies that are in unusual places or difficult to get a good flange on with a good seal and that kind of thing. I mean, you're probably going to see this pretty frequently. Like not long ago, I had a patient that had had 3 abdominal surgeries and then they did the ostomy. He had a colostomy. And the stoma was kind of off to the side and it was like in this little valley, not a flat surface for sure. It was in between 2 surgical incisions, so there was not a lot of room to put any kind of a flange on for this patient to get any kind of seal. And then the patient comes home after the surgery and of course their weight changes and the whole landscape changes and it just gets even harder to get any kind of a device on there. So I've tried everything that I knew to get some kind of seal to prevent this from leaking into the wounds and from leaking onto the skin, but I was having a really hard time. I talked to my peers, I had the nurse practitioner go look, I talked to the doctor. Nobody could figure out what we could do to make this work better for the patient. And I was packing ABD pads around it, but I knew that this was not a long-term solution because I didn't want skin breakdown to happen. So I wasn't sure what to do. And I was looking on the device, on the box that the flange came in, and I saw a phone number for the company. So I called the number and I asked them, I told them the situation and I said, do they have any suggestions? And it turned out that they have a nurse that works for that company, that's all that nurse does, is help with these kind of situations. So I set a time to call and I spoke with him and explained what was going on and described what it was looking like. I had wanted to send pictures, but in this day and age with HIPAA, I never know what we can and can't do because I know this law's changed. So I didn't send pictures, but I explained to him really well what was going on. And 2 days later, I got a big box filled with things that I had never heard of, things in there that I didn't know existed, I had never seen, and very detailed instructions. And I was able to get a good seal around the stoma, get a different kind of flange on there and a different kind of bag, and we were able to seal it and stop the leakage. And so, protect the patient's skin and prevent leakage from going into the wounds. And it worked really well. So that's something to try if you find yourself in that situation. Call the company and see if they can help you in any way to determine what you need, because there is a lot of stuff out there that in all my years I had never seen before. So I hope this tip was helpful. If you have any tips that you think would be helpful for hospice nurses, please let me know. I'd love to share them here. And remember, together we can change our world.